Hi, everyone. Let me ask you something. When your child gets sick, especially at night or on the weekend, what do you do first? Or where do you go for their care? Do you go to urgent care just to feel reassured? Or maybe the emergency room just in case? But here's the real question. Do you feel that those providers truly know your child and treat him accordingly? And if you have gone in the past, does it feel like starting over every time you go? Stay with me because the last part of this video is what most parents really need to hear. And if you're ever felt unsure, insecure, overwhelmed, or even a little scared when your child gets sick, this video is for you. Hi, I'm Dr. Kathie, and I'm a board-certified pediatrician. I've been caring for children and their families for over 4 decades now, and teaching and helping parents feel calm and better informed about their child's health and development has always been my goal. Here's what I've learned from over the years with parents, as well as experiencing it myself as a parent. Parenting is already stressful enough. You should not have to second guess what to do or where to go when your child is sick. So in this video, I would like to share with you a few things. Number one, what a patient-centered medical home is and why it matters more to you and your child. Secondly, the biggest mistake parents make when choosing where to go for care. Number three, why urgent care and ER visits can sometimes lead to misinformation. 4, when is it actually appropriate to go to urgent care or the emergency room? And then lastly, but most importantly for all of you parents, how to feel more confident making decisions when your child gets sick. And make sure you stay with me because the last part of this video is what most parents are really looking for. So let's get started. So what is a patient-centered medical home and why is it so important in the care of your child? Now, don't let the name confuse you. A patient-centered medical home is really not a real place. It's actually a developed concept that describes a working relationship between a patient and their medical care provider. And this is just not specific for pediatrics. It also applies to adult medicine as well. In our particular video today, it means your child has one primary pediatric provider who knows your child's medical history, tracks your child's growth and development over time and can easily note if something is just not right, understands how your child typically responds to illness, understands the dynamics of your entire family, which is something really important, and builds a long-term relationship with your family. This is what we as providers call continuity of care. We keep track of everything that pertains to our patients, the medications, past medical history, family dynamics, what the specialist had to say the last time, et cetera, et cetera. And this is one of the most important principles in all of medicine and one that unfortunately is getting overlooked more and more. Medical care is becoming more fragmented than ever with the advent of urgent cares and the use of emergency rooms for non-emergencies. I get it. They're a lot more convenient. They might be close to your house or be open when your physician's office is not. So this is where I would like to offer support, helping parents reduce unnecessary urgent care visits driven by fear or uncertainty, and instead helping you make informed, confident decisions pertaining to your child's care. Because when your pediatrician or pediatric provider knows your child, they just don't treat the symptoms. They treat your child as a whole. What does this really matter? Well, let me paint a picture for you. Let's say it's 8 p.m. and your child has just developed a fever. They're uncomfortable, they're coughing, and you're worried. You go to the urgent care. They check your child, maybe run a test, give you instructions, and you go home. But here's what's missing. They don't know your child. They don't know that or what your child's past medical history entails, or if your child tends to spike high fevers quickly, or if your child had similar symptoms before, and what is your child's baseline health? Now imagine the same situation, but with your pediatrician or pediatric provider. They recognize what's normal for your child. They know when something is truly concerning and when it's not. They know your child's past history and past patterns of illness. And they know your family. What is so important about that difference between these two options? Well, when seeing your pediatric provider, it tends to reduce unnecessary testing, unnecessary medications, and a lot of unnecessary anxiety. Now, don't get me wrong, urgent cares and emergency rooms are incredibly valuable, but they're not designed for long-term or recurrent pediatric care. To note, they are often staffed with providers who have not had extensive training in pediatrics. And as we say, children are not little adults, and they should not be treated with big people protocols. And something many parents don't realize, but records from urgent care or ER visits are not always shared with your child's primary provider. So there's no communication between the urgent care or the emergency room with your child's provider, and your provider is kind of left out in the cold. So what happens? Every visit to an urgent care or an ER becomes a new story, a new provider, a new interpretation. And this leads to what we call fragmented care. And over time, that can mean missed patterns, misdiagnoses, repeated visits because the correct treatment wasn't provided the first time, and less personalized decisions. So your pediatrician, on the other hand, is your child's medical home, the central record keeper, the long-term health partner, and the coordinator of all of your child's medical care with others, and better equipped to handle pediatric problems. So this is something I've seen over and over again in my 40 plus years of being in pediatrics. Parents don't take their child to an urgent care or an ER because they want to. They go because they're scared, they're unsure of what to do, and they go because they don't know what's really normal. But many childhood conditions like colds and fevers and ear discomfort and rashes and so many other things, they can all be managed at home or with a visit to your pediatric provider. And I wrote a book that helps you navigate that decision, which way to go. When you understand what to watch or look for and when to call, everything changes. You feel more calm, you make much better decisions, and you avoid unnecessary visits and treatment. Now, the part that I told you to stay for, because this is what parents really want and need to know. When should I take my child to the emergency room? Well, you should go immediately if your child has difficulty breathing, a severe injury, persistent vomiting, signs of dehydration, seizures, or anything else that feels life-threatening to you. And always call 911 into emergencies. But for most everyday illnesses, your first call should be to your pediatrician or pediatric provider. And even after hours, many offices have on-call providers who can guide you. So here's what I want you to know and to take away from this video today. Choose a pediatrician or pediatric care provider that you trust. Build a relationship with that provider while your child is well. Don't wait until your child is sick to make your first appointment. Schedule regular well visits on the recommended schedule, and call your pediatrician or pediatric provider first when something comes up. Because when you have that relationship with a pediatric office, you just don't get care. You get guidance, you get reassurance, and you get confidence as a parent. And that is something that urgent care simply cannot provide. If this is the kind of content that you would enjoy, please subscribe to my channel. And please follow my social media for more free resources and helpful content. And I'd really like to hear from you. Drop a comment below and tell me what kind of topics that you would like to hear in the future. So in summation, parenting doesn't come with a manual, but having the right support makes all of the difference in the world. Your child deserves a provider who knows them. and you deserve to feel confident in your decisions. And finally, if this video helped you, please subscribe and share it with another parent. And check out my book, the Kids Medical Care Handbook, for more step-by-step guidance on everything that can go wrong with kiddos. I'm Dr. Kathie, and I'm here to help you raise healthy children with confidence of your own.